So let's talk a little bit about caregivers and what their roles are. We've talked a little bit about that, but you know, there is this really important bond between the patient and the caregivers. The caregivers take on new responsibilities and routines. They might all of a sudden be in a role of support that they're not used to. They might experience anxiety, fear, depression, and the same range of emotions that the patient feels. They might feel very overwhelmed by all of these things, especially if they have a family to also take care of. So a good thing is to figure these things out beforehand, before surgery. Planning is great. Planning is your friend, and try to set up a schedule. And you might have not only one caregiver, or you might need not only one caregiver, but you might actually need more people who rotate and help the patients through this time. Again, a plan is a great thing. So organization here. Caregivers keep track of the medications, the appointments, the daily care and supply needs. And it's very easy to get lost in all of this and get overwhelmed. And here are some of the things that we have heard from caregivers, successful caregivers, of things that they have done before. Also, from a caregiver perspective, what it helps, sometimes it helps to be less, you know, there are people who are these take charge people who are trying to take control of the situation, and this might not go over too well with the patient, especially if they are also have a strong personality. So there might be some conflict in the making. So there needs to be some negotiations, and this can be done by also giving some tasks to the patients as well. Managing medications, there is a medication list. There are a lot of places where you can download these kinds of templates. You all have seen these pill organizers. Those are great. So this is something that you can ask your care team also to help you with, to figure out and to reconcile the medication that you have. That is actually something that is quite important. After bladder cancer and after surgery, if you're on medications beforehand, you will be on medications afterwards, and there will be a lot more of it. So talking to your physician or talking to a pharmacist to reconcile those medications is really, really important. If once the medication is no longer needed, it's important that you just safely dispose of it. Don't flush it down the toilet. You can return it to your pharmacy or in your doctor's office. There is really, I mean, we all have to be aware of the as a caregiver of our limitations that we feel. As I said, it can be quite overwhelming. The caregivers might as much experience sadness and anger or loneliness than a patient feels. They might feel guilty for the things that they can't do, or that they might miss out, that they can't take care of other things. So it's really it can be a stressful time. And one of the most important things, and I've stressed this a number of times, is that talking openly about one's feelings and talking with other friends or family really important. And if necessary, also seek help. And you need a break. So as a caregiver, if you feel that you are really distressed, then signs of that is that you feel exhausted, run down, or irritated, that you don't sleep well, that you do not enjoy the things that you used to enjoy, that you don't even want to talk or to your friends, or that you withdraw from them. And again, address these things before your own health suffers. The caregiver might need also a caregiver. And things that help the patient also help you, right? Exercise, eating right, taking breaks, talk to others, join a caregiver support group. And you can do things. These conversations can really be quite nice for you too, so that you have you can, if you open up, you will see that your patient might open up as well, and you can do fun things like playing cards. And the more support that the caregiver has, the better the outcomes are for the caregiver as well as for the patients. If you there are programs that allow you to take off from work. There is the Family and Medical Leave Act that entitles you up to 12 weeks of unpaid time off if you can afford it. And I have listed some of those requirements there. So the employer or your employer must have at least 50 employees. There, you must have worked 12 months at this place, and you must have worked for about 1,250 hours. But you can talk to your HR department to figure these things out. And here's a list of some additional resources that I've put together for you. Of course, there is BCAN, there is the American Cancer Society, Urology Care Foundation, there's the Cancer Support Community, the National Cancer Institute, United Ostomy of America Association, and for caregivers, Help for Cancer Caregivers, My Cancer Circle, American Cancer Society's Caregivers Resource Guide, and the Family Caregiver Alliance.